Thank you, Madam Deputy Speaker. And I rise to speak in support of the motion that's been put forward by the opposition bench today. And if I can also put on record my thanks for the extremely hard work that's been done by a number of colleagues on this side of the House to raise this campaign, particularly my honourable friend for Barnsley, who I follow on this side. Madam Deputy Speaker, community pharmacies play a really crucial and critical role in my constituency and indeed right across the country. We know from the many statistics and the inquiries and the surveys that have been done that they are trusted. If I speak and listen to my constituents trust the pharmacists that they engage with in those community pharmacies, and they also develop very close relationships with the people that work inside them. And I see it for myself when I go to collect my prescriptions locally. They're enormously busy places. I note that the member for Hertsmere, who I followed, he called it that they deliver drugs. Well, they do so much more than just deliver drugs within our communities.
That was not the point I was making. I was making the point that there are many large-scale dispensaries, particularly, for example, in supermarkets, that do little more than deliver drugs. What we need to do is focus on those community pharmacies that actually provide those wider services.
Well, I think the honourable member just rose to speak in support of the opposition day motion. I make this point also following the last urgent question that we had. I listened very closely to what the Minister said last time, and he particularly talked about how far he expected people to travel, and he talked about all these community pharmacies that weren't very busy. I've actually made a point over recent weeks of actually looking through the windows of my community pharmacies to see if any of them actually are in fact empty, and it's fair to say that none of them are ever empty at any point. I'm in a moment going to reflect on the statistics that show how busy our local community pharmacies actually are, because the figures really do speak for themselves. We know that the average community pharmacy sees on average 137 people every single day. They dispense 87,000 prescription items over the course of a year. They support on average 250 people with diabetes, 389 people with asthma, 463 unpaid carers, 805 older people, 1,317 people with a mental health condition, and 1,416 people discharged from hospital. And that last point is particularly important. I'm not going to presuppose what the Health Select Committee report that comes out tomorrow might say about pressures on our winter A&E services, but it's fair to say that many people are expecting that following a summer crisis in our A&E and within our hospitals, that our local hospital services are going to be under enormous amounts of pressure, and our community pharmacies already do a really important job of supporting our constituents and patients that have been discharged from hospital. I have had the opportunity to listen to members of my local Liverpool local pharmaceutical committee, and I asked them for what the local stats and figures were, so I was equipped for this debate. And I was really struck by what they had to say, and particularly this very important point that honourable members have already made the point in response to the Minister, and it's regretful that he's no longer in his place, about the pharmacy assessment scheme and actually how it has been put together, because it's enormously regrettable, and I put that politely, that it doesn't attribute for deprivation, which means that those pharmacies in the most deprived areas of our country, where patients have greater health needs, are not entitled to claim the payment. And I made the point in an early intervention, and I make it again. In Liverpool, where we've got some of the highest levels of deprivation, Kensington Ward in my constituency is in the top 20 in the country. I have no pharmacies in my own constituency that are eligible for the pharmacy assessment scheme payment, and just 2 across the whole of Liverpool are, one in Croxteth constituency and one in Netherley. And that means all of the 129 other community pharmacies across Liverpool and 6 distance-selling pharmacies face the full funding cut and put at risk the very vital service that they offer to my constituents and the people across Liverpool. Now, we know that the funding cut in this financial year already has had an impact on our local pharmacies. Some have already curtailed their free, with unfunded delivery service to patients, and again my honourable friend from Barnsley made the point about the hours that these services are often provided. These are a lifeline, these services, a lifeline for housebound and vulnerable patients across our country. We know that others are already in the process of making staff redundant, and these pharmacies will have to survive on fewer staff, meaning that the pharmacist in some of our community pharmacies will inevitably be tied more to the dispensing bench rather than undertaking the enhanced clinical role that NHS England, the Department of Health and ministers are expecting them to deliver under the 5-year forward view. The point about deprivation is so very important, Madam Deputy Speaker. As my honourable friend for Leicester South has already alluded to in his very important opening remarks, it is outrageous that this pharmacy assessment scheme, as outlined, will further widen health inequalities in our country. We've got a very specific debate to discuss this in this House next Tuesday. I just ask the Minister to reflect on this issue. I think we've got a responsibility in 2016 to close the gap, not put forward schemes which are going to widen it. And I particularly note the fact that the scheme at the moment makes no provision for patients and communities with protected characteristics under the Equalities Act 2010. Madam Deputy Speaker, I know there's many honourable members who wish to speak, and just to make two very brief points in the 13 seconds I have left, that members on both sides, well, in fact, the Minister, keep on calling these community pharmacies private enterprises. There are many cooperatives across our country, often in rural and isolated areas, providing these services. And I will stop there.
I'm afraid the limit has to be dropped to 4 minutes. Julian Sturdy.